So maybe I'll just start by speaking to Vyxeos. So Vyxeos is approved in what some people refer to as high-risk AML, and that's AML that is either treatment-related, which is very challenging to provide treatment for. It arises from prior cancer treatment typically, or AML with so-called myelodysplastic changes. So that's the approval. In that setting, Vyxeos is very, very effective. In fact, is known to have a survival advantage, even in the follow-up that we had at 5 years follow-up. The way Vyxeos works is to take a conventional chemotherapy combination that is used in AML to encapsulate it in what was determined to be a sort of optimal ratio of one drug to the next in a carrier, a lipid carrier. And the idea of that lipid carrier is that it targets Vyxeos to the malignant myeloid cells and helps to spare cells in the rest of the body. And some of the research leading up to that clinical trial showed that Vyxeos can do just that. It tends to go more to the bone marrow than to other organs. In fact, it tends to go to myeloid type cells in the bone marrow, and there's even evidence that it tends to go more to the rapidly dividing malignant myeloid cells that are AML in patients. And as a result, you can deliver effectively more drug to the cancer and less drug to the rest of the body, and it creates a better safety profile. And so overall, it seems to be better tolerated for certain side effects like hair loss or gastrointestinal side effects. So Vyxeos, by virtue of that mechanism, has again been very effective. And so when you have a backbone like that, it's natural to ask, will it combine with other therapies that are effective in AML? And so that's the process that we're going through, is to really just look for every other AML therapy. Can it be combined to result in a better effect for patients? Really with the curative intent. Vyxeos is used with the intent to cure patients with AML, to get them into enough of a remission to get bone marrow transplant, which is really the only curative therapy for AML. So in that context, we know that there are a number of different therapies that are emerging, in some cases that specifically target mutations in AML, and in other cases are targeting a particular pathway that's important in AML. So the idea was to do a study where we, just like for Zepzelca, where we combine with other agents, determine whether it can be given safely at full doses, and then progress into a preliminary estimate of efficacy. And as you pointed out, the so-called VFAST study has 3 different arms, arms A, B, and C, A being with venetoclax, B being with midostaurin, and C being with inacidenib, which is an IDH inhibitor, midostaurin being a FLT3 inhibitor. And so this study set out again to do just that, to assess the safety, tolerability, and preliminary efficacy. And it's ongoing. So what we found was that for arms A and B, venetoclax and midostaurin, that we could give the full doses of each drug in a way that's well tolerated. Arm C is still enrolling and will ultimately determine the recommended phase 2 dose. And with that, we're seeing preliminary evidence of efficacy that would be promising. Yeah, so we already know a lot about the use of biomarkers, especially in these combinations. So for example, for arms B and C, the FLT3 inhibitor and the IDH inhibitor, we would look specifically for those mutations in patients to allow them to enroll in those arms, because those therapies are targeted to those mutations. But it's also true that there are many other mutations that occur in AML. We're still learning how those mutations may be relevant to selecting the best therapy per patient. So we're certainly doing a more general cytogenetic analysis to look to see how we can best match patients by using biomarkers, to the best therapy. Yeah, and so again, I would just say that Vyxeos is a highly effective drug in that high-risk population that I described earlier. It's known to have a survival advantage. It's very effective in getting patients into a deep remission to allow them to have the opportunity for cure with bone marrow transplant. And so the idea in BFAST is to look in combinations where that can be helpful to even benefit more patients ultimately toward the goal of a cure. But we're also very interested in going beyond that defined high-risk population into other AML patients. And so we have an ongoing trial with the German AML cooperative group called AML-SG. And in that study, we're looking at, treating AML patients who are not just that high-risk group, but also intermediate risk, who have not yet received AML therapy, to look to see if we can extend that benefit of Vyxeos to a broader group of patients.